now we have a patient here. And now, the first thing is making sure that everything is safe around the victim. And you can see everything is clean. So the next thing is to check for the pulse. So you can check for the pulse. We check for the carotid artery. And you can see. And if it's not there, now we turn on. We check the airway. And the airway, we look at the raising and of the chest cavity. And now if it's not there, then the next thing we result to is something called CPR. So the first thing is we raise the head and tilt. Raise the chin and we tilt the head in this position. Then the next thing we do is we come to the chest compressions. And in the chest compressions, we place the right hand at the lower side of the sternum. And at the right hand. And then we tango it with the left hand. So your hand should be at 90 degrees. Now we start pressing. It should be 100 to 120 per minute. Now, and we go deep by 2 inches or 5 centimeters. Now here we go. We start by 1, 2, 3, 4, 5, 6, 7, 8, 9, and so on and so forth until we reach there. And then we result to, after there, we come to 2 breaths. So the 2 breaths, you can have the ambu bag or you can use the mouth to mouth. The mouth to mouth, you load this way, you close the nose, then you give mouth to mouth. So if it's not responding, we come to the AED. So we are taking this as our AED. Now we're gonna connect the AED on the 2 parts of the breath, like the nipples, the so-called nipples. Now we connect them. We say this one side of the AED and this one. So we say that we have connected the AED. Then we leave the machine to tell us what to do. And if the pulse still is not there, the machine will just direct us because there is no pulse now. The machine will tell us to press for the shock. Now we move so that we cannot experience any shock. Then you press the AED. On pressing, it will shock the patient, and then you give it some minutes so that the machine can interpret the patient. And if not yet, we'll come back to the chest compressions before we come back to the AED again. We don't get rid of them. They remain there. And then we continue with our chest compressions. Remember, the hands should be like this. So you come 1, 2, 3, 29, and 30. And we give back the breaths. And if you have the ambu bag, you can use it. It will be simpler. It will be simpler. Then we come back to the AED. This process will continue until the medical personnel comes around, or the patient starts to move. Thank you, and that's our tutorial for today. Hallelujah. Amen.